10 seconds. Live.
Welcome to the COVID313 Coalition for Families and Students. I am Christine Bell, honored to serve as the Executive Director at Urban Neighborhood Initiatives and a proud member of this coalition. And I feel like I haven't been here in so long, so it's nice to be back, even though we're going to have a shorter program today. I'm so delighted to be with you today. So we're going to jump right in to our town hall today. But remember, we want to hear from you. So please put your comments or questions in the chat on Facebook. We've got Brooke and Lindsay that are waiting to hear from you. But let's make sure they're on their toes. Why don't you tell us where you're joining us from today? And like always, we are translating the town hall to ASL and to Spanish. So we want to give folks a little bit of time to get to the right place. So Christina, could you please share how to access Spanish interpretation?
Buenos días, buenas tardes pues. Bienvenidos a la charla de COVID-19. Si quieren escuchar en español, vean el enlace en el chat o vayan al Facebook de Urban Neighborhood Initiatives para escuchar. Gracias.
And our ASL interpreters will be joining us soon. And so if you do need ASL interpretation when they come on, they will be on screen. And so they'll be on screen throughout the webinar. You can pin them. We will also be recording the video with closed captioning for later viewing. So as soon as they're on, you will obviously see them. So we want to thank our two experts that are here today to talk with us about COVID. So a few logistics for those folks. Please remember to speak slowly for our translators. They really want to make sure that they're translating the information that you're sharing correctly. Turn off your camera when you're not speaking to ensure that our ASL interpreter, once they're on, can be seen. And please remember to mute yourself when you're not speaking. And it does not look like our infamous timekeeper is on today, but I'm not sure that we're going to need to keep so much time because we're only having one group today. But if for some reason we're getting close to the end of our time, myself or Jametta will pop onto the screen and remind you to wrap up. So with that, I am going to hand it over to my co-moderator, Miss Jametta Lilly. Jametta?
Thank you, Christine. And yes, it does feel like it's been a while. So this is amazing. And so my name is Jametta Lilly, and I am proud to serve as the CEO of the Detroit Parent Network. I'm also a proud member of the COVID313 Coalition that now for more than 2 years has consistently been bringing information to families, to professionals, to community folks, to stakeholders about how to stay safe through COVID. How do we keep ourselves educated, empowered, and accessing the basic needs we need, as well as a focus on social justice. So we're going to begin the program, as Christine indicated. We've been at this now for not quite 2.5 years, but what actually spurred us to begin was what our next segment is going to focus on, and that is the impact of COVID. And as folks say, it ain't over yet. And so we need to understand, where are we? What's the reality that is on the ground, particularly here in the city of Detroit, which, remember, does not have the same demographics and dynamics necessarily as the state of Michigan or even the nation. And to help us always to better understand not only COVID, but staying healthy and well overall, we're always so pleased to have join us again from our own Detroit Health Department, Tanea Hackney, who is the outreach nurse and really just an awesome advocate for the health and wellness and stomping up COVID and stomping out health disparities. Nurse Tanea, where are you? Love to see you.
Hi, Miss Jametta. It's always a pleasure to be with you guys. And you are so awesome. I just have to say that.
Well, we'll just start sharing these words with each other. And so for our audience who doesn't know this, many of us went almost 2 years and had never met each other. We met each other in these boxes. And so we've had a little bit of a break, haven't we, Tanea, where we still have masked up and we've gotten out, and you and I've actually met each other, as well as my other colleagues, Christine, and so many of some 12 organizations that make up the coalition. But enough about us. What is going on? Give us some understanding of what are the numbers? What are we seeing as case rates? What are our vaccination rates? Just kind of start right there, and then we'll, of course, we have some more questions for you. Or if you even have any slides, you're always welcome because they're so informative.
Well, I appreciate that. You know, I always try to come prepared with slides. And whenever I can have some sharing capabilities, I would love to tell you guys about the current numbers, the vaccination rate, and our positivity rate, what that looks like in the city of Detroit. I'll also share what the Detroit Health Department is recommending as far as masks and things of that nature, and share some resources that we have and some exciting upcoming events for the summer.
Wonderful.
Just waiting on Sheen's screen sharing.
Okay, and while that's coming up, I want to say to our audience, as Christine indicated, we want to hear from you. So put your questions in the chat. We're going to hear not only from Nurse Tanea, but we're also going to hear from Dr. Allison Wyman from the Henry Ford Health Systems. So we're going to get an opportunity to hear from that important public health lens, but also directly from a physician that's really attuned to what's going on with infectious disease. Okay. You've got the screen. And by the way, families, you can get access to all of these materials after the program through our One Detroit site and see these slides again. Go ahead.
Thank you, Ms. Jametta. So as we look at the numbers, we're looking at the positivity rates from May 27th till at least June 2nd. What we're seeing in St. Clair Shores is, 24% positive, Macomb 19.5, Oakland 19, Washtenaw County 15, Wayne County 17, Monroe 18, and Detroit City is saying 5.3. Michigan in the whole entirety is saying 15.4. I do want to just reiterate that these numbers do not include individuals that are not testing, that are not having symptoms because they've been vaccinated, or just not having symptoms at all. And also, it doesn't include individuals that are testing utilizing home tests and not reporting them. And, just so many avenues that we're not seeing these numbers come in correctly. But because of the way they're looking at getting these roundabout numbers and knowing what variances are in around Region 5, which includes us in Michigan and Chicago and neighboring Ohio, those states around us, looking at those wastewater treatment samples that they're bringing in, these variances, and studying these numbers tells us we're a little bit higher than what these numbers are stating. So Detroit, as of 6/6, unfortunately, we've seen over 130,000 positive cases since COVID started. That doesn't include before COVID. This is when they said, you know what, we're in a pandemic. So we did also see over 3,400 confirmed deaths because of COVID. Right now, we're looking at, in the city of Detroit, with at least one vaccine shot, just at 50%. Completed means that you've had your first dose, your second dose, and your booster. That is 42.3%. So if you look at the bottom left side of the screen, that kind of is in a category of ages. So our youth are like at 10% being vaccinated. And if we look down to the more green area, you'll see 65 to 74 are highly being vaccinated. So we encourage those that can get vaccinated, please get vaccinated. It's not enough to bring COVID to a total end. We need to get vaccinated if you can. Right now, the city of Detroit recommendations are wearing a mask indoors, because although those numbers I reported says 5 point something for Detroit, we're still higher than that. And our numbers can keep going higher if we don't mask indoors. So mask indoors, especially if it's a crowded space. Get tested if you're exposed and if you're showing symptoms. It could be allergies, a nasal run, it could be a headache. We're not sure. The best way to find out, get tested so you don't spread it to anyone who might get severely ill or who might pass because of it. Get vaccinated and boosted if you can. That's going to lessen your symptoms. If you do test positive for COVID-19, call your primary care physician. You can call Detroit Health Department if you've gotten treated there or somewhere else, and you can actually get treatment. There's oral medications that you can take, and we will treat you in the city of Detroit. Just call our phone number, 313, and I'll put this number in the chat, 876-4444. To get an appointment for testing or for vaccines, call us at 313-230-0505. And these are where you can get treated for COVID symptoms as well. If you need to order home tests, you can go on the website, covidtest.gov, or simply call 800-232-0233. I want to make sure we have as much resources as possible because we want to help. We want to make sure that we're here for you and you have access to everything. So the Test to Treat program is what I mentioned earlier about you being positive and you wanting to get treatment. To call and see if you're eligible, because there is a test, there is an evaluation, call 313-230-0505. The biggest question throughout the city of Detroit that we get on the nurses line, how do I know how to quarantine or when should I quarantine? I'm going to leave this here if anyone wants to take their phone and use this QR code, you can actually go on this site, and it's the CDC website. It's a tool that will help you determine when to go into quarantine and when to come out of quarantine. It gives you specific recommendations just for you because you're going to answer these questions. This is the first page of what it looks like. It's like a Dropbox. You answer these questions, it'll give you the exact date. So if I go in and do this right now, it'll say if I'm, whatever is going on with me, and you can go in and play with it. Just get that information. This tool is available to help. And I'd highly recommend utilizing it. The city of Detroit wants to definitely encourage vaccines for children. So we do have 2 specific sites for children, Northwest Activity Center and the Detroit Health Department at 100 Mack Avenue. This summer, we have so much going on. So the City of Detroit Immunization Clinic has gotten with HAP. We've gotten with other providers, United Health Group, Aetna, and we're still making phone calls. Immunizations are present, and that's just not COVID. That means all of your immunizations. That's just not for children. That's for adults, for children, anyone who needs vaccinations. There'll be bike giveaways, lots of things given away.
Yeah.
Children's Special Services will be there. Safe routes, lead testing, lots. We're trying to get food trucks there. We have all summer at all of these places. We're trying to get that health clinic ready. This is every Saturday in August. So we're calling it a summer back to school blitz. If you need more information, just contact us. We'll give it to you. This is that again with all of those locations all over the city of Detroit.
Great.
The last thing I want to reiterate or tell you about is something that our team kind of came up with to talk about, what can we do like we're talking about right now? How can we prepare for the summer? And how can we take our summer back? So the things we want to talk about is masking, making sure we answer those questions about what can you do safely during the summer. So please, if you can, if you're available, Tuesday, June 21st, the time from 6 to 7, please get on this town hall and let's talk.
Yes. Today, we've got also, we want to have a little bit of time for Dr. Allison to join us, but I do want to reinforce a couple of things you said. Everyone knows you can actually call Nurse Tanea personally. She always makes her number available. You see now that there are multiple places that you can go and get the booster shot. You can go and get more information. And I'm just loving to say, we're going to make sure Detroit Parent Network and many of the partners that are part of the COVID313, we're going to show up in these same locations, bring our services, bring our resources, because it takes the whole community to make sure that we are not only stopping COVID, but that we're safe. So to all of our partners out there, whether you are PAL, whether you're a school, whether you are a faith-based organization, tune into that conference call that's going to happen next on the 21st, because we have all got to be mindful of how we can work together to keep our children safe, because if we have an uptick in COVID, it may mean that our babies and our children cannot go back to school safely. So this is serious business, is it not?
It's very serious.
Serious, isn't it? So prevention. At the same time, we're dealing with, in some cases, still acute disease. And I think that's probably, Tanea, what I'm going to do is shift. Thank you. As always, hang tight because we may have some questions. And at this point, I really would like to open it up to Dr. Allison Wyman, who is with infectious diseases at Henry Ford Health. Dr. Allison, welcome.
Thank you. And thank you all for the hard work this group and others are doing. It's very appreciated. This is definitely a team effort. It takes the city, not just a village, to get this COVID stuff done, and we're not done yet.
Yeah, yes, as you well know. Could I ask, you have some things I know you want to share, but one of the things that in the data that Nurse Tanea shared, one, it was the case rates. Again, but we don't know that because we have a lot of people who are testing or just saying, I'm just going to stay at home anyway. But what about hospitalizations? Could you share a bit about what you're seeing, not only in Henry Ford, but maybe Beaumont and Ascension hospitals? What does it look like?
Sure. Thanks for the question. This recent surge has been a bit different than the other surges in that we've had a lot of people getting affected because the particular variants that are circulating right now are very transmissible, very contagious. It hasn't translated into as many people being hospitalized or having severe disease or dying, which has been great. We've loved to see that. And that's really a combination of things. One is the variant is not as aggressive as some of the earlier variants. That's great. Also, people are getting immunized, and it's really important. I want to stress the importance of being boosted. At this point, if you've just received your first 2 shots and it's been months and months, you're really not protected anymore. And I think a lot of people don't realize or appreciate how important those boosters are to get your antibody levels up. The other game changer that we've had recently is that we can treat early or mild COVID in patients as an outpatient to prevent severe disease and progression to hospitalization and death with monoclonal antibodies, which right now, at least Henry Ford has quite a lot of. And we also use Paxlovid quite a bit, which is the oral antiviral medication, which has proven to be quite effective. So all of those things, Plus, of course, prevention is still the best thing we can possibly do because treatment for COVID hasn't changed that much for many months. So we really want to prevent people from getting sick. We want to prevent people from getting to the hospital. And if you have mild COVID and treatment and you're able to be treated at home, you're likely to do well, even if you have risk factors. But importantly, keep up to date with your immunizations. Don't hesitate to mask and take comments from people, which are sometimes not polite. But it's really your own business what you do. And then make sure you let your doctor know if you are diagnosed with COVID, either from a home test or otherwise, so you can get early treatment.
Great, thank you. I love that statement. Whatever you decide to do with this is your business, not other people's. Because people do look at you funny, but that's all right. I'm being safe. It's not against you. I'm protecting everyone else. You talked about the antiviral medications that are available. Now, are any of those over the counter, or do you have to have them prescribed by a physician?
Right. Well, currently they are available with prescription. I believe there's some moves to make it over the counter, but I haven't been involved in those conversations. The reason why it's going to be important that folks review that is there are a lot of medication interactions with especially Paxlovid. And so there has to be specific recommendations made as to sometimes holding other medications, or you may not be a candidate for Paxlovid depending on your other medications, in which case monoclonal antibodies might be better for you. So there is some clinical judgment involved. And I also want to emphasize that the earlier you let somebody know that you've tested positive at home or you're concerned about symptoms, the better, because these medications don't work. Paxlovid you have to have within the first 5 days, monoclonal antibodies, 7 to 10 days. So the earlier you work on it, and an antiviral always works better early in the course of disease. Later on, they're really not very effective.
Okay.
So early diagnosis is very key.
And most things, is it not? But certainly in this, we have two questions. One is, so who is available or who is maybe eligible for a second booster? Could you talk about that?
Yeah, so second boosters are for folks 50 and older, because we know that older people, immunity is not quite as robust and it wanes, and younger people who are immunocompromised. So I know the recommendations for the boosters keep changing. There will undoubtedly be more boosters. They may change the composition of the booster to cover more of the current variants. But right now, it's really important you just keep up to date with whether or not you're eligible. The CDC website, cdc.gov, the state websites, all this information is very readily available online. And if you don't have that information, your primary care doctor should be knowledgeable about who's eligible for boosters. And they're also widely available. So if you can't get to one of the state websites or state sites, if you live near a big chain pharmacy, you should be able to get it. And remember, they are now free. So all the medications and all the vaccines are free to you. And so that's a really important point. So it's not going to cost you an arm and a leg. It's just they're free for right now. And that's to encourage people to get treated.
Yeah, such a good point, because unfortunately, we've heard reports of community folks going to neighborhood pharmacies and then being charged not only for medication, but also for the shots themselves. And so just as an infectious disease physician, are we talking generally every 6 months? Is that something that people, particularly people over 50 or who may have some compromise with their immune system, is that something they should begin to be thinking about as their health routine?
Yeah, so right now we don't know what the frequency, I think that's your question of what will be the ongoing frequency of shots. We really don't know. But for right now, and that's why it's really important to keep up with current guidance, because it's likely to change. Very soon, hopefully, we'll have immunizations for younger children, and that'll be also a bit of a game changer. And then to increase the rates of older children vaccination. So it's going to change. We don't yet know. It depends a little bit. You know, this is a global disease.
Right.
So unfortunately, if a variant arises in South Africa, and we're watching 2 variants that did arise there that are rising in the United States right now, then suddenly it's here at home with us as well. So it's not clear. We're hoping to get a vaccine in the next who knows how long, but in the future, that will be down to once a year or 6 months. Right now, the recommendation is for 4th booster after 5 months. So if you're one of those folks that were very keen to get immunized and you got your 1st and 2nd doses back a year ago or more, you definitely need to be boosted. So please remember that, because people feel this really sense of security, right, which is great from vaccine. But it's really important to acknowledge that those vaccines wane. And if it's been many months since your last vaccine, over 5 months, you should look and see if you're eligible for a booster, because folks who were immunized a long time ago really are almost the same as not being immunized at all.
And I appreciate you making the point, and for all of us to remember, this is still a relatively new disease. It is changing. And as we keep getting new variants, there's other factors. So please, families, as you listen and you hear people say, well, they changed it. Well, the nature of this disease changes. And thank goodness that we have scientists who are tracking that and then accordingly trying to change medications and information for us. So it's important to stay tuned to not only CDC, but really importantly, right here in our own city. One last question before we get ready to move to our closeout, and that has to do back with this issue of testing at home. So what if a person tests at home? Are they supposed to report that to someone, or do they just say, I'm going to stay put? What is it that people should do?
Yeah, so it's variable, right? And it's great. We've all got tests now. Remember, months ago, you couldn't test at home. You had to find a place to get a PCR test.
Right.
So it's really a game changer. So I would urge people both to have tests at home stored up for any minimal symptoms you might get. And remember, this can just look like a little cold, runny nose, sore throat, nothing major. You want to make sure you test because you're likely able to transmit the virus to other people who may be more vulnerable than you and may have a poor outcome. So testing at home is a great idea. It is not mandated reporting in many situations. So that's why, as was referred to by the previous speaker, the undercount is significant because people are testing at home. You do need to have a positive test of some kind, although you're not usually asked for proof of positive test to get a Paxlovid prescription, et cetera. So some employers do require that you report the positive test. And some occupational health of different healthcare associations do require that you report it. But a lot of people are going to be not reporting and just doing it at home, which is fine as long as they isolate at home and they know, and they also reach out to their primary care providers so they can get treatment if they need to.
Yeah. Thank you, because that is really skewing our data, is it not? It's going to be more interesting as we move forward. So Detroiters, you see we have an exceptionally low level of positivity in contrast to some of our surrounding areas. That's speaking to that so many more people are precisely testing at home, and in many cases not sharing that information. So this is a case where the data isn't necessarily, which we know there are many factors that make it less accurate. So folks, keep that in mind. And we like to call people by their first name. So Dr. Allison, just as a way of connecting, thank you so much for diving in with us. As you know, we're always so pleased to have Dr. Cunningham and many of the physicians from Henry Ford, as well as we've been blessed to have physicians from, Wayne Health, Wayne Pediatrics, and not to mention our own Chaz, FQHC. So we appreciate all of you in your efforts to keep us safe.
Thank you. We appreciate you and appreciate the invitation. Stay safe, everybody.
You. Great. And so we're going to move into the closing, and it is, in some cases in the past, what we have done is had a moment of silence because we have lost too many people, right, Christine? And we continue to lose children and families to violence, everyday violence and horrific mass killings. But there's something that can be done. And so with that, I want to hand it to Christine because there's information and there's an opportunity for us to act on this and on budget items. So Christine, what should we be doing?
We should be heading, if you can, on June the 11th to the gun violence march that is March for Our Lives. And we're going to put a link in the chat for you to find a march near you. The one in Detroit is on the 11th. And this is an opportunity while you're sending your prayers and energy to the families that have lost their loved ones. This is an opportunity to have your voice be heard, and to share with our legislatures that this needs to change. that they have a responsibility just like we have a responsibility. So so that is on June the 11th, but the chat that we're dropping the link in the chat. So if you can't join on the 11th, maybe there's another one that's near you that you're able to do that. 482 Forward and the Michigan Education Justice Coalition are working hard to make sure that their legislature, that our legislature includes the following this year's budget weighted funding for special education, English language learners, and at-risk students, 300 million for counselors, and money for our school facilities. I feel like that was a bit jumbled. So essentially, we've got a budget that's coming up, and we need more money for counselors and for school facilities. And so 482 Forward and Michigan Education Justice Coalition is asking that $3 million be set aside for counselors and for facilities. Both really important, particularly as we're hopefully moving out of COVID, and as we're grappling with what is happening in our families and in our cities and in our country at large. Please make sure you click on the link in the chat and email your legislator today. And then there's a number of COVID resources that you'll have access to, and I think that is also being dropped into the chat. We are so grateful to be with you now every other week and to share important information with you. So, oh, there's a question that was asked when vaccines for those under 5 will be available on the Detroit Public Television page. And since we do have a few minutes, is the doctor still on?
She may not be, but I think people can stay tuned. We know that it's still going through the process, but there hasn't been a release date that I know of. Oh, Dr. Allison, you're back. Question exactly for you.
You're on mute. And she's got her white coat on, which means she's about to go do some important patient seeing. Go ahead.
I'm sorry. Yes, we're hoping that the CDC and others are meeting to look at the data for the youngest children. So hopefully, and I've heard touted the date the end of June, but those dates have always changed in the past. So I'm hoping sometime in the next month we'll have those vaccines available for children, which will be wonderful.
Awesome. Thank you so much.
Thank you.
All right. So again, thank you all for being with us today. It is our pleasure to be with you every other week. And as we go into the weekend, enjoy the sunshine, stay healthy, stay strong, and remember that you are powerful, and please use that power in the issues that are really important to you. Thank you all. Have a great rest of your week.
Great. And we'll see you at the UNI event tomorrow, Christine.
Oh, yay.
Yes, we'll see you at that.
Yep.
And families, please follow that link. Our voices must be heard on the legislation. There are millions, if not tens of millions of dollars that are available to help our children in our school-based health clinics and mental health resources, resources for extended learning, after-school programming. It won't happen unless we make sure our voices are in there to make sure that it's culturally competent and is serving the needs of our families. We would love at the very end if you would come on screen, because we do everything that we do as a team. So there's a front group, us moderators, and then there are people in the background like Deja and Colleen and folks from our Detroit Public TV team. And even we have obviously our translators. If you would, and even those who joined us today, if you could come on video, and we just always like to give each other a shout out, see some faces, spread some joy, and say goodbye. So 1, 2, 3. There we go. Okay, we got Nurse Maria. All right. Okay, we almost had Christine. Ooh, we got Miriam. I love it. Okay, we've got Michelle. We had some awesome fellows, public health leaders from U of M who were joining us. in addition to some of our other team and those of you that are in our audience back home. Stay strong.
See y'all later. Have a great week.
Thank
Rest
you.
of the week.